seeing a question from Shelley regarding oral immunotherapy. Um, that's a good question. We've seen um, um, there's a lot of people who do what's called oral immunotherapy uh, for food allergies. The problem with that is it's not FDA approved, it's not standardized, and in that case, it makes it a little bit of challenge. Um, um, I'm not sure if our video is transmitting good today. Seems we have. Let me see if I can close any other open applications at all. Maybe this will help. In any case, oral immunotherapy can work in reducing the amount of food ingested that will trigger an allergic reaction. However, so far, studies that have been done with oral immunotherapy, although they show some effectiveness, they are still considered high risk. The incidence of systemic anaphylactic reactions in those cases runs around 30 to 40%, which requires use of epinephrine in many cases, um, and therefore there's no standardized protocol that um, we can follow to say this is the way that is the safest and most effective to be utilized. Um, there are other methods that are under um, research studies for treatment of food allergies. The most exciting one is what's called epicutaneous, in which you will be applying a patch similar to a nicotine patch that can be replaced once a week. It is safe. It may be slightly less effective, but the safety profile is very high. And it can be worn while swimming, getting all kinds of activities. And I think it's going to be a very promising way to treat food allergies. It is in the what is called as phase 3 clinical studies, and it has been in the pipeline for quite a few years. So I'm hopeful that we'll be able to start using that in the very near future. Other methods that are also under research for use with food allergies are called biologics, and these in sort of an injection that blocks your allergy either to general to everything or more specifically to the food you're allergic to. Biologics are something that we use to treat asthma in many cases and hives, as well as eczema recently. You might be familiar with it in something like Humira, which is used for arthritis and other autoimmune processes. But again, that's another promising area. So, uh, although oral immunotherapy is effective, it does carry a high risk. And at this point, we do not recommend or perform that um, um, to our patients. So, if we have a more definitive evidence and standard protocols, that we'd be more than glad to do that. I have personally contacted one of the grandfathers of food allergy research, Hugh Sampson, in the past, and um, again at that time he was not able to recommend going ahead with that. So until we get the green light, we're still on hold for that.